seeing Ash Chandra as a cytology hero and his being so successful both nationally and internationally, and his work in expanding diagnostic cytology, especially FNAC, at Guy's and St Thomas's after I retired, it's like seeing your children succeed, and it makes me very proud to hear him regard me as a mentor. Now, I was drawn to cytopathology at first by seeing what happened when it went wrong or was lacking in quality control. When I started doing cytology, the cervical screening program was in a parlor state, poor training and lack of interest in the subject. This became a major interest of mine, improving our own practice, training and quality control, and measuring the effect of screening on the incidence of cervical cancer. Is the immediacy of a cytological diagnosis, the possibility of making a diagnosis of malignancy or excluding malignancy in a matter of minutes, and being able to help clinicians manage their patients promptly. I loved both on-site diagnosis and multidisciplinary meetings in that context. Don't worry about saying you don't know. If you can then add that it's not A or B, it helps as well. Communication is the aim of the game. Well, while I was working in cytology, my family occupied most of my but after I retired, I enjoyed editing Cytopathology and taking part in the annual European tutorials for quite a few years. But now I have to confess to a completely new and rather unusual activity. I am now the honorary secretary and the newsletter editor, having always loved editing, of a society that believes that Edward de Vere, the 17th Earl of Oxford, wrote the works behind the pseudonym William Shakespeare. It's a fascinating topic,